Alexis Taylor has never felt more prepared to treat real patients. She credits that to working with fake ones at the Interdisciplinary Simulation Center at the Medical College of Georgia.
Simulation lab has helped my learning in that you're able to see situations in patients where you can practice on how to respond and the correct treatments and what you don't do before you actually see a real patient. And even though you know it's not a real patient, you still kind of feel like it is because your level of energy just goes up, especially when someone is crashing or something like that. And it helps us with our response time and just really prepares us for actual patients in the clinical setting.
The Simulation Center is really important for a student's education because it helps bridge basic theory and book knowledge to clinical decision making for them in the clinical setting.
8 interactive simulators are set up in separate rooms in the newly renovated center to emulate a hospital-like setting.
We do have 2 of the high-fidelity anesthesia simulators. We also have 2 of the emergency care simulators, which are also high-fidelity simulators, and they are portable. We also have 2 pediatric high-fidelity simulators, which that way we can actually branch off into the pediatric population. And we also have a baby simulator, a high-fidelity baby simulator, and an OB simulator or a birthing simulator, and she actually can give birth to a newborn baby.
Is it time for the milky stuff now? Is it time for the milky stuff now?
The simulators are connected to computers, and their functions are controlled by Center Coordinator John Gillespie. They can breathe, urinate, salivate, bleed, blink, or cry.
Is there anything else we can do for you? I know it's kind of hard to have all these people in here, but...
Keep that thing from beeping. Are you sure it's not warning you that you're not supposed to put coffee cream into somebody?
No, it just...
So what a student can actually do is be able to experience a critical situation or just care of a simulated patient in the simulation center before they actually care for a real patient in the actual clinical setting.
One simulation lab, we were doing the endocrine system and we were studying diabetes insipidus. And learning about it in class, you get an idea of it, but you really don't understand it. So we come to lab and we actually had a patient with that diagnosis. Then about 2 weeks later, I had a patient who actually had that in the hospital. And so I really felt like I really knew what I was doing going into that situation, having seen it in class and in the simulation lab.
We don't get a crisis a lot of times in our regular clinical rotations, and so when we're exposed to it here and we get a chance to, well, kind of get that initial reaction, you're kind of scrambling about what to do, and then the next time it's a little bit better and you're a little bit more composed about what you're doing, and where it's going to be tense and you're going to need to remain calm and do your job.
We take things very seriously in simulation and try to make it as close to the clinical experience as possible. And our instructors ask us to do that, and it helps to create a real atmosphere here, and it helps us to be more comfortable in the clinical setting when we do get our hands on a real human patient.
And that's why a simulated education is a great way to bridge the gap between the classroom and the hospital. For MCG, this is Amy Connell reporting.